Hello, today we will be discussing the second section of Chapter 14 on stress and health. And to begin with this section, we will actually discuss techniques that have been shown to decrease stress or stress management techniques. And so what we know of stress is that stress can also manifest as tension in your neck muscles, back pain, a knot in your stomach, sweaty hands, or even wrinkles. So thinking back to whenever you were just stressed out, maybe you had a lot of tests and projects going on, you could really feel that tension in your neck. So techniques such as relaxation, biofeedback, and aerobic exercise are useful in managing these kinds of stress. So if you think about just rowing a boat, the muscles involved in performing that act will tense just a little bit. A researcher by the name of Jacobson discovered that using electromyography or EMG, which measures the subtle activity of muscles, he discovered while using this machine that our thoughts can create muscle tension when we're not even doing anything at all. So just thinking about something can cause muscle tension. So these observations are what led Jacobson to develop relaxation therapy. So this might involve relaxing one muscle group at a time or imagining a warm flow over your body. And so meditation, hypnosis, yoga, and prayer all have elements in common with relaxation. So they all draw on a relaxation response where as soon as you get into a comfortable position, quiet down and focus on something repetitive or soothing that holds your attention, your body starts to relax. Relaxing on a regular basis can significantly reduce people's symptoms of stress and can even reduce blood levels of cortisol. So it's also been found to reduce tension headaches, make cancer treatment more bearable, and reduce high blood pressure. So alternatively, we have biofeedback techniques for stress reduction. And biofeedback is a high-tech relaxation technique where an electronic thermometer gives you feedback about your physiological functions, so you become more aware of them and learn to control them more quickly. It's usually just as effective as relaxing and is very beneficial. People who don't respond to relaxation may find this of a more useful alternative. And so the next thing that we talk about is aerobic exercise. And aerobic exercise is any exercise that increases your heart rate and oxygen intake for a sustained period of time. Exercise has been found to be associated with psychological well-being, such as lower levels of depressive symptoms. And so researchers have tried to tease this apart by assigning people to exercise versus no exercise comparison to see what are the benefits of this exercise, of aerobic exercise, in comparison to different groups. And so one study had college women participants split up into 3 groups. They were either in the exercise condition, the relaxation condition, or no treatment at all. Those in the exercise group were less stressed than any other group. Other studies have found that as little as 10 minutes of exercise can actually boost your mood. So you may be wondering, why is this? And that's a very good question. Research is still not entirely sure of the process of what's going on with exercise, but what we do know is that some studies suggest that there's an increase in our body's production of serotonin and endorphins, which tend to increase our positive mood. So either way, it's recommended that you exercise on a regular basis. And when we talk about how much, you are supposed to exercise at least 30 minutes of moderately vigorous exercise every day. And this dramatically decreases your risk of any chronic illness. One way of improving stress is managing your stress through your environment or situation, and social support can be one of the most effective ways of decreasing stress. So one of the more self-defeating things that you can do in life is to fail to connect to other people. So just failing, quote unquote, to get married, for example, can be a detriment to your health. And so research has actually demonstrated that those that are unmarried have elevated risk of mortality from cardiovascular disease, cancer, pneumonia, and influenza, chronic obstructive pulmonary disease, liver disease, and cirrhosis. So good ongoing relationships and participation in social activities, religious groups can be as healthy for you as exercising and not smoking, interestingly enough. Advantages of social support include your partner helps you remember to exercise, follow doctor's orders, and eat healthy. And also talking can be really beneficial and won't cost you money. And also within this partnership, you share tasks and you help each other reduce each other's workload and worry or stress. And so those with low social support are often more stressed, experience more depressive symptoms, and are more susceptible to illness. So college freshmen who report the greatest feelings of isolation also showed reduced immune responses to flu vaccinations. And we also see that women tend to seek social support more often or more so than men do. So this may be due in part to gender stereotypes and men being seen as tough and handling anything and everything without any help. There's also evidence that humor can also help us to cope with stress. So humor reduces sensitivity to pain and distress. It also has been shown to reduce the time needed to calm down after a stressful event. So one example of this is that one study found that men viewing a highly stressful film about industrial accidents were asked to narrate the film either seriously or by making the commentary as funny as possible. Men in both groups reported feeling tense and showing increased levels of sympathetic nervous system arousal like heart rate, sweat, and temperature. But those in the humor group came back to normal levels more quickly than those in the serious group. So here we move on to talking about the psychology of health and further discuss that connection between our mind, body, and behavior. So personality can influence health through enduring traits that make some people more susceptible to health problems or stress, because personality isn't something that we can choose. We're just born with it, so it's out of our control. However, optimism and hardiness are both personality traits that have been correlated with positive health outcomes. Patients with higher levels of the trait optimism were less likely than other patients to need rehospitalization for complications such as an infection and or heart attack. But remember, this type of studies, they are correlational. So it doesn't mean that optimism improves physical health. It just means that there's something about optimistic people that's linked to better health outcomes. So rather than improving physical health directly, optimism seems to aid in the maintenance of psychological health in the face of physical problems. So when sick, optimists are more likely than pessimists to maintain positive emotions, avoid negative emotions like anxiety and depression, adhere to medical regimens, and keep up relationships with other people. So this doesn't mean that pessimists are doomed, though. Research has shown that even diehard pessimists can be trained to become significantly more optimistic, and that this training can improve their psychosocial health outcomes. So people who seem thick-skinned or are able to take stress or abuse that would be devastating to others also seem resilient when faced with stress-induced illness. So when comparing people who did and did not get sick following stressful life events, those who were stress-resistant were termed hardy. And so they showed commitment or the ability to become involved in life's tasks, even in the face of significant stress. So it's believed to be due in part to their belief in their control over the situation, or the expectation that their words or actions would influence their lives and their environment. And so again, control over the environment. They often are more willing to accept a challenge, so seeing it as an opportunity for growth rather than a setback. So this trait too can be learned to some extent. Unlike personality traits, engaging in positive health behaviors is something that we can control to change our health outcomes towards more positive outcomes. Unfortunately, even though most people know that eating healthy, having safe protected sex, and not smoking are important to our health, they don't really seem to do anything about it. One of the biggest reasons we do unhealthy things, even though we know that they're dumb, is because we run out of self-regulation. And so self-regulation is the exercise of voluntary control over the self to bring the self in line with preferred standards. And so examples of this include asking ourselves, do I want a salad or do I want a cheeseburger? And so this often involves putting off immediate gratification for long-term gains. So choosing the salad because I know I want to live longer, I want to be healthy, as opposed to the immediate gratification of a tasty, greasy cheeseburger. So there's substantial evidence that suggests that self-regulation requires strength or willpower that can also be fatigued. And so in other words, control in one area may exhaust your self-control in another, so leaving behavior in other areas unregulated. So if we're trying to quit smoking, say, you probably do not want to start your diet that same week. So the take-home message is to choose your battles and focus self-control on the things that will most likely damage your health, because you'll be able to pinpoint or put all your energy and regulation towards that specific behavior. So speaking on health behaviors, eating healthy is detrimental to your health, obviously, yet dieting does not always work because our stress levels and mood can also influence that self-regulation. So when it's low, we more often give in to temptation, and the more you think about certain things like non-diet foods or that cheeseburger, the harder it is to resist them. So when you are stressed out about all the tests and projects you have to do in class, are you more apt to go for the glazed donut, or are you more apt to go for those carrots? So significantly, in 2008, 67% of Americans over the age of 20 were classified as overweight or obese. And so that's just the almost state of the U.S. in terms of health behaviors, and kind of health behaviors gone awry. So when speaking further on these health behaviors, we also want to discuss smoking. And so despite all of the available information on the negative consequences of smoking, 21% of Americans still smoke cigarettes. So often people report smoking as a form of stress reduction. So thinking about this, as psychologists, we can work with the individual to replace smoking with a healthier, more adaptive way of coping with stress rather than reaching for those cigarettes. So interestingly, research has examined the way people think about their risk when compared to other people. So this is called unique invulnerability. So an example of this includes sexually active females estimated others' chances of getting pregnant at around 27%. But when they were asked about their own risk, they rated themselves as about a 10% risk of getting pregnant, even if the circumstances were the same across everyone. So prevalence of unsafe sex is difficult to estimate, but about 21% of Americans currently suffer from an incurable STD, while 15 million contract one or more new STDs each new year, and another million live with HIV or AIDS. So these stats alone were from 2006 and have most likely risen since then, as scary as that sounds. The three most common STDs among college students, this includes the HPV or human papilloma virus, which causes genital warts and cervical cancer and is an incurable disease transmitted through sexual skin-to-skin contact and often does not have any symptoms. The second is chlamydia, which is easily treatable when caught and can be transmitted through vaginal, anal, or oral sex. And the third most common STD among college students is genital herpes. And so about 1 in 5 college students are infected, and it's incurable and causes redness and multiple blisters that spread easily through contact. And what we find is that in order to prevent the spread of STDs and STIs, include protection and sex education. And so that wraps up the second section of Chapter 14 on stress and health.